It's a reality. More and more of us will become infected with COVID-19 in the coming weeks and months. Now, apart from social distancing, wearing your mask and washing your hands, there is more that is in your control. People with underlying medical conditions can be more vulnerable, and diabetes in particular is of concern. Recently, the Western Cape said 52 out of every 100 COVID deaths in the province were people with uncontrolled diabetes. Premier of the Western Cape, Alan Winde, who tested positive recently, is himself diabetic. Let's discuss this now with specialist physician Dr Adri Kok. Good evening, doctor. Thank you very much for your time. Why are high glucose levels a real problem for outcomes with COVID and immunity?
Thank you very much. Yes, this has been seen around the world that the high glucose levels seems to be an aggravating factor, and it's also a predisposing factor. So on the one hand, people with diabetes who are poorly controlled are more likely to contract the virus, but also have a more severe progression of the disease, could have. So one of the most important factors is to have very, very good control of your sugar levels. If a person sees, and we've seen this in the last few days, that patients phone in and they say their sugar levels have gone high, you can be sure that the first thing we do is test for COVID, because this is a sure indication that they might have COVID underlying. We've also seen that the patients have a resistance to insulin, so you have to have higher doses of insulin to control the sugar better as you fight the virus and get the patients under control.
Isn't it true for all diabetes, though, that if you're diabetic and you become infected, it's much more difficult to control whatever illness you contract?
Yes, I think your immune system clearly would be affected, but COVID specifically have this inflammatory response, and the high sugar levels seem to be aggravating that response. And this is why the patient with diabetes with COVID that go into the more aggressive form of COVID really poses a problem. And again, you have to use higher doses of insulin. One of the treatments that we use in the patient where there's this inflammation is, of course, dexamethasone, which is a steroid. And in that situation, you have to control the sugar even better, because that can push the sugar levels up. If you look at the response, again, many of our diabetes patients do also have some kidney problems. We know that about 15% of patients have kidney impairment with COVID. And so that combination is really like a perfect storm. And one has to be very aware of the possibility that kidney function could also be affected. So various factors play a role here.
Is it something of a surprise? Because before COVID came here and really entrenched itself, we were so worried about HIV, because we've got so many people with HIV, and how that combination could be really awful. And we were also worried about TB, but we're actually seeing the most vulnerable people are those with diabetes, uncontrolled diabetes, as you say.
It's been very interesting also to see how many people are poorly controlled. So I think I've had 12 admissions just today of people who are diabetic who have now been tested positive for COVID. And it's a sicker patient. They have lung problems. Of course, the inflammation starts in the lung. There's the heart problems that these patients may have that's underlying. And if they have any kind of blood vessel disease, where there's any hardening of the arteries, what we call atherosclerosis, of course, the reason this virus is so bad is it causes little clots in the blood vessels, which originates from this effect that it has on the lung. And it causes this inflammatory response. It's like infection that just aggravates itself. Then it causes these little clots in all the organ systems. And if you have diabetes where there's cardiovascular or blood vessel disease, patients with any kind of heart disease, heart failure, etc., of course, this would just be a disaster for them to get the virus as well. So they are the sicker patients, and we're just seeing more of them. And these may not necessarily be older patients. I think one has to be very careful not to think that it's only the older patients that are so sick. We've had 40-year-olds, 45, 50, 60-year-old patients that have been severely affected. So my advice would be that you have to watch your sugar levels very, very carefully. Make sure that if there's any abnormality on your sugar levels that's not been there before, act on it. One of our biggest problems is that patients are coming to the intensive care unit or to the emergency department too late. And I understand there's pressure on beds, but there's pressure on beds for people that need it, like these patients that we're speaking about.
So it's important to control your blood sugar and your glucose levels. I understand that exercise, not just diet or medication if you are a diabetic, I understand exercise is crucial here as well. How do you exercise if you've got COVID-19 though?
Very difficult because you really feel dismal. You don't feel like exercising, and of course, if it's affecting your lungs, you're going to be short of breath. So I really wouldn't suggest exercise in this setting at all. We would like patients, if at all possible, to have a meter called a pulse oximeter, which tests your oxygen saturation on your finger and also gives you a pulse rate reading. And that's a very nice way to see if there's any risk if you are testing positive for COVID. And this is whether you're diabetic or not. If you're diabetic, of course, it's even more important to check this carefully. If your oxygen percentage is between 90 and 94, we would be concerned, but that's still reasonable. If it's below 90, you really should seek medical attention fairly urgently. That would be the person that we're very worried about.
Doctor, I want to ask you...
That's now apart from your sugar level, sorry.
No, I think it's so interesting that you mentioned the oximeter, because oxygen levels is a big talking point. And as you're saying, not just for diabetics. Would you recommend, we're moving towards the peak of this pandemic here in Gauteng particularly, August, sometimes September. There's real concern that there won't be enough beds, whether you're in the public or the private health sector. We know that authorities are trying to do all they can, but is it something that you would recommend, that you actually get an oximeter and use one at home?
Yeah, I think that our general practitioners have done a fantastic job keeping people at home, and so just escalating the more severe cases. I'm lucky that I'm in a private practice and we have close contact with our general practitioners, and they have the freedom to phone us and ask advice. And if at all possible, we try and prevent the person from escalating, getting to the point where they need admission to hospital. So the pulse oximeter really makes a massive difference, because you can monitor and you can advise the patient when to be worried. We watch their sugar levels, of course, if they're diabetic, and we can give short-acting insulin if needed, just to boost their insulin response and to make sure that we control their sugar levels if that becomes a problem. And these, of course, are people who are symptomatic of COVID. So, the symptoms could be loss of sense of smell, taste. Very often you don't have a fever, so the temperature readings may be completely normal. It may be just flu-like symptoms, sore throat, sometimes diarrhea. So it's not the usual flu symptoms that one would expect. And one has to be if there's anything unusual, act on it. That's really what I would suggest.
It's so interesting you explaining that the blood glucose and controlling sugar levels crucial for diabetics, particularly at this time. But I'm just also wondering about people who are not diabetic, but perhaps who eat badly and who load their systems with sugar. They get a sugar spike. Is that also risky behavior at this time?
No, I don't think you can relate those two. But what we have found is that we found quite a number of patients who were now with COVID found to be diabetic, and they hadn't been diagnosed before. So that is that's a definite finding as well when we look at patients coming to the hospital. The other point is that they did find that if your sugar levels in hospital are high, even if you're not diabetic, you have to control that sugar level very carefully, especially if the person's on dexamethasone or oral steroids, because the high sugar can worsen the clinical course of the patient. So we're very, very careful, apart from treating with blood thinners to make sure the patient doesn't have clots. We're very careful to monitor their sugar levels and to keep them under a reasonable control. We want a sugar level between 5 to 7 millimoles per liter, which is, below that would be normal. But 5 to 7 would be the target that we aim for whilst the person is in hospital, whether they're diabetic or not. that would in any case drive the process of inflammation. People who are overweight and obese, obesity itself causes inflammation in the body. And this is why obese patients, again, is a very high-risk group. And we've seen quite a number of these patients have really not done well when they've come in, whether they're diabetic or not. So to speak to your point about the diabetes, whether exercise, for example, and a prudent diet, absolutely crucial, absolutely important.
Well, thank you so